Hi, Dr. Pelto here. We have a patient, he has a wart here on the bottom, and I think he probably got this at college because it's some communal showering. Now you see there's a blister around this. It's because I applied cantharidin yesterday. Cantharidin is a kind of a blistering agent, and that's usually enough, but it takes a number of visits. And in this case, we are going to remove it because of, and see that blister? That liquid is from the cantharidin. There's a little blister, and that's what the cantharidin does. But in his case, he's not going to be around for the summer, so we are going to remove this wart. Any pain? No. When you remove a wart, you want to get good edges. So you want to go, 2 to 3 millimeters around it. So one of the temptations is just to remove just the skin on top, but the problem is the wart usually goes a little bit deeper. So even though you take off the top, it tends to be a little bit further down here. So there's the wart. Now, the big challenge with warts in general is the risk of recurrence, because they do have a high recurrence rate. And a lot, I guess recurrence isn't the issue. I think the bigger issue is we don't take enough out. So, it could be recurrence, or it could just be not going deep enough. You try not to go down to the fat level, because the level of the fat is where it's going to kind of scar. You doing okay?
Yep.
Good. Okay, so you can see here, good edges, a tad bit of the subcutaneous fat in there, so that should be all out of there. Okay, this tends to bleed a lot for patients, and so I like to put, first of all, we put a little triple antibiotic on there. Now, as you see, it's going to bleed a lot. And so before, I put a little cautery to stop the bleeding. It's a little sodium hydroxide. So this is the same thing we actually use to kill the, if you've watched any of the videos about the ingrown toenails, we use that to kill it. That hurt?
Nope.
Okay. Making a face.
Yeah.
So that's to make it kind of stop bleeding a little bit here. And I put a little triple antibiotic on there. Put a whole bunch of gauze because it's going to bleed. And so if you can stay off your foot as much as possible today, it's probably bleed for 2 or 3 days.
Oh wait, it's done?
Mm-hmm.
Oh, what the heck? It was so fast.
That could take longer, but
No, I mean,
Yeah, it is real quick.
If it's out, it's out.
And so I try to put a real compressive dressing on it, and I'd like you to stay off it pretty much today.
Okay.
Because if you walk too much, you're going to have a bloody mess in your shoe.
Yeah. I wouldn't want that.
And then I like to use elastoplast. This is a really kind of a tight tape. Once again, I can put more compression around it. And all this is just to prevent the bleeding. There we go. Stop it.